And shared health update with Dr. Atwell, Dr. Reimer, Monica Warren. They will have opening remarks after which, and then we'll see how our time is. Please stand by. At this time from the Free Press. Asking questions for
Recording in progress.
All right, folks. I think we're all gathered. Let's get going. Please proceed, doctors and Monica.
Good morning. My name is Dr. Jas Atwell, and I'm the Deputy Chief Provincial Public Health Officer for Manitoba. I have a few comments before I pass it over to Dr. Reimer. Public Health reported Manitoba's first case of the B11529 Omicron variant Tuesday. The individual recently traveled from one of the 10 federally advised countries and has experienced mild symptoms. Public Health continues to conduct aggressive case and contact management. If additional public health risks are assessed and it is deemed necessary to protect the health of others, more information will be released. Public Health will not be providing any additional information related to this case or future Omicron case. Further cases will be reported in our regular bulletins 3 times a week. While we understand the media and public are curious to know all the details, gender, age, health region, vaccination status, hospitalization status, date of arrival, date of testing, we will not be making this information available. Public Health is committed to the privacy of this individual and to the privacy of future cases, and we want to reduce any stigma that may come as a result of the diagnosis. The case was already been reported in our regular updates. We are now reporting the results of further sequencing, which resulted in identification of Omicron. Again, if any additional public health risks are assessed and it is deemed necessary to protect the health of others, more information will be released. We understand that the news of an Omicron variant case in Manitoba might create feelings of anxiety and concern. We are all tired of the pandemic. We are all tired of restrictions. The news of a new foe in this fight is not what we wanted to hear, and not what we wanted to hear ahead of a time of gathering together with friends and loved ones. I want to acknowledge this concern and anxiety and offer some assurances. The arrival of this variant is not unexpected, and we are prepared to address this new variant. We knew it would make its way to Manitoba. It was just a matter of time. It is now here, and we are doing everything we can to reduce the spread of COVID-19 and variants of concern. We are keeping a watchful eye on the variant as there is still much to learn about it, including its infectiousness, if there's any vaccine escape, and virulence. The laboratory is screening positive COVID-19 specimens for mutations associated with variants of concern to allow early detection. These are followed by a confirmation test. Public Health is aggressively conducting case and contact management to slow the spread of COVID-19. This includes variants of concern in the province. We are reviewing public health measures to align with changing national guidance and incorporating emerging evidence. At this time, there is no pending changes to the current public health orders. We also continue to monitor known and emerging variants in Manitoba. We are doing everything we can to help slow the spread of COVID-19 to protect Manitobans and our healthcare system. but Manitobans have a role to play as well. You might be asking what you can do to protect yourself and those around you from COVID-19, the new variant, as well as reduce the strain on our healthcare system. The new variant spreads the same way as the original COVID-19 virus. Manitobans should continue following public health orders, limit contact with others, focus on the fundamentals to limit the spread of COVID-19, including variants, and protect themselves and those around them. Be sure to get fully vaccinated and go for your third dose as soon as you're eligible. The best line of defense is to get vaccinated. This is still the best way to protect yourself and your loved ones. Yes, we are seeing breakthrough cases where those who are fully vaccinated are testing positive for COVID-19. But we are also seeing is that the symptoms and outcomes are more mild if you are fully vaccinated, which helps reduce the strain on our healthcare system. Remember, in Manitoba, the unvaccinated are 5.5 times as likely to become infected, 8.4 times as likely to be hospitalized, 19 times as likely to end up in ICU, and 11.8 times as likely to die from a COVID-19 infection compared to those who are fully vaccinated. The vaccine makes a difference. To find a vaccine location near you, visit protectmb.ca and book your appointment or visit a walk-in location. Be sure to check yourself for symptoms every day. Stay home when you are sick, even if symptoms are mild. Get tested if you have symptoms of COVID-19 and self-isolate until you have the results. If you test positive, follow public health guidance, self-isolate, and cooperate when providing contact tracing information. Maintain social distancing. Wear a mask when social distancing is not possible. Wash your hands when social distancing is not possible. And follow all public health advice and direction if you have returned from travel or have been identified as a close contact to a case. We all play a role in preventing COVID-19. We play a role in staying healthy and following the public health orders, focusing on the fundamentals, and reducing the strain on our healthcare system. We need to continue to work together just a little bit longer to slow the spread of the virus. I want to remind Manitobans that as of Monday, December 6, 2021, public health orders require youth aged 12 to 17 years attending indoor sporting and recreational facilities, including extracurricular activities offered by school, to provide proof that they have received at least one dose of the Pfizer, BioNTech, or Moderna vaccine for COVID-19. If they have not had at least one dose, they must provide proof of a pharmacist-confirmed negative result from an approved rapid antigen test from a test taken within the 72 hours prior to participation. The public health orders do not allow other healthcare providers to confirm a test result. The orders apply to all youth aged 12 to 17 entering any indoor sporting or recreational facility to watch or participate. These facilities include, but are not limited to, school gymnasiums, classrooms, multi-purpose rooms, community facilities, such as arenas. Both indoor practices and competitions are subject to the orders. Families are encouraged to contact the local pharmacy to confirm if the pharmacy provides these tests. In addition, pharmacies set their own prices for the service, so people are encouraged to ask about the cost. For clarification, approved rapid COVID-19 tests include the Abbott PanBio COVID-19 antigen test, the BD Veritor COVID-19 antigen test, and any other test for COVID-19 approved by the Chief Provincial Public Health Officer. All other public health orders and guidance will continue to be followed. It is the responsibility of the facility operator, including public and independent schools, to ensure the public health orders are followed. Finally, I want to continue to encourage to get your flu vaccine. Manitoba continues to have doses available and is not too late to book an appointment. This year, like last year, we need to keep Manitobans healthy and to reduce the strain on our healthcare system. As of Friday, December 3rd, 22.2% of the population had been immunized against the seasonal flu this flu season. We need to do better, and I know we can do better. The flu vaccine and high-dose vaccine are available at local public health offices, nursing stations, pharmacies, doctors' offices, and community clinics. I recommend you contact your healthcare provider before you go get your vaccine to ensure they have it available. Thank you, and I will now pass it over to Dr. Reimer.
Thank you, Dr. Atwell. I'm Dr. Joss Reimer, the medical lead for Manitoba's Vaccine Implementation Task Force. I'd like to first highlight some of the latest COVID vaccine statistics in Manitoba. A total of 2,221,246 doses of a COVID-19 vaccine have been given since the Protect MB campaign began in our province. 89.1% of the adult population have been immunized with at least one dose. 86.8% of the population over age 18 have already received their second dose. And we hope that this is a good indicator that they will receive their third dose as soon as they are eligible. When it comes to youth, over the age of 12 and up to age 17, 88.6% have received at least one dose, and 86.1% have received a second dose and are fully vaccinated. For our children age 5 to 11, 32,500 kids have already received their first dose in the first week and a bit of the campaign. There are 2,787 doses scheduled to be given today in this age group. So that's a high-level picture of where we're at as a province from a numbers perspective. But now I'd like to talk about the third dose and why we want people to get it. So people often ask me, why is it important if I'm fully vaccinated, and what does the third dose do? These are good questions, and I'm glad to have a chance today to tell you more about them. First, I'll go back to the basics about vaccines. The COVID vaccines are highly effective, but no vaccine offers you 100% protection. And over time, the effectiveness of your vaccine may decrease. That happens at different rates for different people, depending on the strength of their initial immune response, their health or health conditions, their age, and many other factors. So this means that while being fully vaccinated provides excellent protection, it doesn't mean that every single person who is fully vaccinated shares the same level of protection. Over time, it's natural, it's normal for your immune response to weaken. This happens with infections as well as vaccines. And this is why we get booster shots for many other vaccines like influenza or tetanus. When it comes to COVID, however, waning immunity can be more serious for people who are at greater risk of illness and who are more likely to be exposed to COVID or have other factors that might affect their immune response. Waning immunity places you in a vulnerable position where you could catch the virus and you could pass it on to others. The current medical evidence supports booster doses to add stronger protection, and that includes a benefit of offering protection against all variants, including Omicron. With the first case of Omicron, the Omicron variant appearing in Manitoba this week, many of us are turning our thoughts again to the protection of the vaccines and the benefits of the booster dose. Emerging medical evidence suggests that COVID-19 vaccines will likely offer some protection against Omicron, because even though it is a variant and it does look different than previous variants, it is still COVID. It will take time for vaccine manufacturers to create and get approval for a new vaccine that is specifically targeted to Omicron. But we currently have booster doses available right now that will be effective. And if you are eligible, I urge you to take the next step and get that dose. The best way to get your body ready to fight, if you should happen to come into contact with Omicron or any other variant, is to get your booster dose. When you get that dose, your body will be flooded with antibodies, bringing the antibodies to a much higher level than they were before, and compensating for the fact that Omicron looks a little different. This is because when you have such a high level of antibodies, many of them will be able to recognize and target Omicron. So while we're certainly worried that a smaller percentage of our antibodies will be effective at recognizing and targeting Omicron, after a booster, when you have such a high number of them overall, this still means that there will be a large enough number of antibodies to work and protect you. So basically, what I'm saying is that we don't know how well you are protected after having 2 doses against Omicron, but it's looking very optimistic for how well you are protected after a booster dose. We are still in the 4th wave of this pandemic, and as the holiday season approaches, there are many reasons to protect yourself, your loved ones, and your community. When you think about gathering together with friends and family, you want to make sure that you are protected against COVID so that you can protect your loved ones as well. So as you're planning a holiday get-together, dinner out with friends, or whatever this season means to you, also plan to get your 3rd dose. We want you to schedule your dose now so that your body has 2 weeks that it needs after the vaccine to develop that full protection against COVID. We've seen spikes in cases after other holidays in the past, and we want this time to be different. So whether you are due for your 1st, 2nd, or 3rd dose, getting as much protection as you can from COVID-19 and from all of the variants of concern before the holidays is critical. If you are healthy, your immune response can be robust, and you can be shielded from the worst symptoms of COVID-19 if you catch it. But the same might not be true for some of your family members, coworkers, children, or seniors in your life. So when you get your booster, you're doing it for all those that you love, for your community, as well as for yourself. Another version of the question that I hear is, does the booster really work? The science is still emerging, but as I mentioned earlier, what we see so far is very positive. In one good example, a study of the Israeli experience demonstrates what can happen to a population when many people get their boosters. Before the mass 3rd dose booster campaign in Israel, the country had one of the highest daily infection rates in the world, with the Delta variant spreading rapidly, and they were seeing decreased immunity occurring across many populations. Today, Israel's case counts are well below what they were when they peaked in the fall. In a recent study, some people who were vaccinated, even with a booster, did test positive for Omicron, but they had only very mild symptoms, and more importantly, there was no evidence of broader transmission from those individuals. The Israeli example suggests booster doses have had a very positive effect in Israel in reducing both the case number and severity. If it's been 6 months since your 2nd dose, so that means that you were immunized around June 8th or any time before that, you are eligible to get your 3rd dose. If you are over the age of 50, are Indigenous, have health conditions that put you at risk, or if you're planning to gather with someone who fits any of those descriptions, I urge you to get your booster now. The vaccine has done incredibly well in protecting us from serious illness, from hospitalization, and from deaths caused by COVID-19. But as I said earlier, even highly effective vaccines often become less so over time. Early research on vaccines that use mRNA to protect you from the coronavirus, like those from Pfizer and Moderna, suggest that eventually they lose some of their effectiveness against infection, no matter what the variant of virus is circulating. So getting this booster shot can help supercharge the vaccine's effectiveness once again. On a separate note, the National Advisory Committee on Immunization recently updated its recommendation on booster doses, but also on mRNA COVID-19 vaccine recommendations for people aged 12 to 29. NACI continues to recommend that a complete series with an mRNA vaccine such as Pfizer or Moderna is preferable to receiving a viral vector vaccine such as AstraZeneca or Janssen. Out of an abundance of caution and in the setting of a robust supply, we are now recommending that whenever possible, young people aged 12 to 29 get Pfizer for their first and second doses, and probably even for their booster doses. This is because the risk of myocarditis, an extremely rare and temporary swelling of heart tissues, appears to be even lower with Pfizer than it is with Moderna. Both vaccines are safe and effective. If only Moderna is available, or if you feel more comfortable with Moderna, it remains a very safe and effective option. I want to be very clear that we are not saying that Pfizer is better than Moderna. In fact, in some ways, newer evidence is showing that Moderna may have some benefits over Pfizer in long-term protection. It's also important to note that the risk of myocarditis is much higher from a COVID infection than from a COVID vaccine. And the severity of myocarditis related to infection is much greater than related to those that happen after vaccine. So we're making this recommendation to choose Pfizer for people aged 18 to 29 to minimize the risk of myocarditis as much as possible. The risk was already very low, but we want it to be as low as possible. Along with getting your booster dose as soon as you're eligible, remember that wearing a mask, staying home when you're sick, and practicing good hand hygiene are all tools that we need to continue to use to stay well and to help keep others around us well. I'd like to switch gears for a moment and let you know that we continue to see good uptake in vaccinations for children since kids aged 5 to 11 became eligible 2 weeks ago. This week, we are launching a province-wide Protect MB Kids social media and print advertising campaign. We want to reach parents where they're at so they know that appointments are available and they know how to get more information if they need it. If you are a parent or a caregiver of children, please visit protectmb.ca for all the information you need to get ready to have your child vaccinated. We have fact sheets, answers to your most important questions, and the online booking tool is there for you as well. Your family's healthcare providers, whether that's pharmacists, individuals at the provincial vaccine clinics, your physician, as well as those at our community clinics, are all ready to help make the vaccination experience a positive one for your child and your family. And with the holidays approaching, you will want to make these vaccine appointments the most important to do on your holiday list. If your child is older, in that 12 to 17 age group, and they've had 1 dose, it's likely time for them to get their second dose to be fully vaccinated. And if you're due for a booster, you can go together. You can book your first and second doses for your children through the provincial call center or use the online booking tool, or you can visit a local pharmacy or doctor's office. The in-school COVID-19 vaccine campaign continues in Manitoba schools for children aged 5 to 11. We are so grateful to the communities and schools that have opened their doors both during and after school hours to make it possible for children to be protected from COVID-19. Schools with clinics will send home information about the vaccine and consent forms to parents and caregivers in advance. In some cases, the schools will also offer vaccine clinics outside of school hours that are open to families and the community. Please make your plans to get vaccinated today. Help a loved one to make the decision to get their next dose. Take some time to go with a person for their vaccine appointment if they would be comforted by your presence. People have so many choices of where they can go for their next dose. As I've said in the past, the vaccine is available in hundreds of locations, including provincial vaccine clinics, physician offices, pharmacies, urban Indigenous clinics, and pop-up community clinics. Please visit protectmb.ca to find the online booking tool, to see the vaccine locator, and where you can locate where you can go most quickly and conveniently. If you still have questions about the vaccine, I invite you to speak with your healthcare provider and visit our website. The answers are all there for you. With that, I will turn things over to Monica Warren, the Provincial COVID Operations Chief at Shared Health.
Good morning, everyone. I'm also the Executive Director of Acute Inpatient Services at HSC. And I had mentioned 2 weeks ago that we were disappointed to be heading into another wave of surging COVID cases. And I want to emphasize that we do not want to be here again. And although these briefings have been primarily focused the last several weeks on progress we are making as a province on vaccination efforts, I also want to say thank you from our health system to all who have made your appointment and gone to get your COVID-19 vaccine. Thank you. Every first, second, and third dose helps to protect you and helps to protect our health system. To all those taking your children to be vaccinated, thank you as well. And your kids, they are our heroes. You're doing your part to help us fight the spread of this virus, which continues to have impacts on vulnerable people in Manitoba. In recent weeks, we have seen an increase in COVID case counts, active cases, and even outbreaks again in our healthcare settings. All of these factors have the consequence of increasing the need to come into hospital and even be admitted to our ICU for the unvaccinated community. So let me be very clear. We are not seeing many fully vaccinated patients in hospital or in ICU. We are, however, seeing some positive breakthrough infections amongst fully vaccinated personal care home residents, hospital patients, and even our healthcare workers, which will happen as we see increasing community transmission and rising case counts. Vaccinated COVID cases are, for the most part, experiencing mild symptoms. The exception remains for our most vulnerable, our sick, our elderly, and our frail, for whom this virus can have a devastating outcome. They are why we have continued to make every plea to Manitobans to get vaccinated, for their health, but also for the health of the many thousands of Manitobans awaiting non-COVID care, but whose access has been delayed because we have been forced to ramp up response to COVID yet again. In October, we shared that we were making every effort to maintain our non-COVID health services as much as possible for all Manitobans. We recognize the toll that 2 years of reductions in services, postponements, and cancellations have had on Manitobans, and our focus really has been on maintaining that care. But we have been headed in absolutely the wrong direction over the last several weeks with rising case counts, which have resulted in seeing higher numbers in hospital and in ICU. 2 months ago, we shared that when we reach an average of 3 new COVID admissions into our ICU per day, this puts a significant strain on our health system's ability to maintain those wide ranges of services. We had 6 new COVID ICU admissions into the unit on Monday. This is the highest single day number of admissions to our ICU since the 3rd wave. We had another 4 yesterday. The number of patients in our ICUs is slowly rising. And as of midnight, there were 98 patients receiving critical care in our hospitals. This is 26 beds over and above our normal pre-COVID baseline capacity for critical care. There were 153 patients hospitalized due to COVID illness in Manitoba. And again, this is up 10 from last week. The recurring theme in all of this is the sheer volume of unvaccinated patients that are driving these numbers and putting the health services of our province at risk. There are 34 patients in ICU this morning with active COVID cases. All but 1 were unvaccinated. This is up from 10 from last week. While our efforts continue to plan to increase our ICU capacity, which has been our primary focus for many weeks, this does not come without the expense of some of our non-COVID services. Every Manitoban likely knows somebody who's been affected by a postponement of a surgery or an important medical procedure, because we have had to increase our ability to care for COVID patients in our hospitals. And many have heard stories told by families of patients who are being moved to sites to other health regions. And this is really in efforts to help protect our most specialized and acute beds in the province. These are significant impacts and they are difficult operational decisions, but I do want to emphasize that these patients continue to receive excellent care, although we do recognize the toll it has on them and their family in order to be able to continue to support them. In prior waves, we were able to increase our ICU capacity by pulling trained staff from other areas in the health system and by training new nurses to work in our most specialized units, including the ICU. We continue to prepare for what might come next, and I want to say we very much value the input of our staff so that we can plan together on solutions that they think would work best. We also recognize that they are our most precious resource, and so definitely want to hear from them how we can support them through these upcoming challenging times. So as our efforts to expand our ICU continue, I want to make note that this is not an easy task for a number of reasons. There are 284 ICU nursing positions currently filled across our system. That is 12 more than we had at this time last year. But during that same time, we've also had 46 nurses leave the ICU, taking very valuable experience with them. This turnover is amongst the lowest you'll find in any hospital unit, but these nurses cannot be easily replaced. These nurses are moving to other opportunities in the health system or retiring after a prolonged and stressful, tiring response to this pandemic. Our workforce is tired. The pandemic has turned their work and personal lives upside down, while many Manitobans have seen a return to some form of normal as restaurants and business, sports, and schools have reopened. Our hospitals and our ICUs have remained stretched for nearly 2 years. With a new and unknown variant and increasing numbers of unvaccinated patients coming into hospital and requiring ICU care, it's getting really hard for our teams to see the finish line. So I want to say a sincere thank you to the staff for continuing to serve Manitobans. We are so grateful. For all Manitobans who are doing your part, getting vaccinated and following all of the public health guidelines, I also want to say thank you. Please continue to do so. For everyone else, please consider your position. Vaccines are safe. They really help to protect you from the virus and greatly reduce your chances of needing to come into hospital and having serious illness. Please do it for yourself, do it for your family, do it for your community. And most importantly, our healthcare workers are asking, please do it for them so that they can be there when you need them for help. They would really like to return to their normal work in caring for Manitobans. And with that, we can now take your questions.
Thank you, Monica. Thank you, doctors. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from the Winnipeg Free Press, Katie.
Good morning, Dr. Atwell. We have one Omicron case in the province. We don't know when the infected person returned to Manitoba. We don't know when they tested positive. We don't know how long they have been isolating. And you've said today that none of that information is going to be released. The travel ban has already been in place for over a week. So how can you be sure there is no public health risk? posed by this case?
So, we've done our public health investigation. We've done our case and contact management with this individual as well. And there's no risk to the general public. We've identified the contacts. The contacts are self-isolating. So we're doing our regular approach in relation to how we're managing a positive COVID-19 case. We're taking some extra measures here in relation to case and contact management as well to ensure, that individuals are partaking in what we're asking them to do with quarantine and self-isolation. So at this point, there's no risk to the general public in relation to this case. Therefore, no information will be provided in greater detail at this point.
And you've also said that no details on any future Omicron cases are going to be released. How have you determined that the privacy of individuals outweighs the public health risks related to the spread of Omicron in Manitoba?
Well, at this point, we still have to learn more about Omicron as well. It is a variant of concern. We still have to understand how much more infectious it is, if it is more infectious or contagious. We have to understand what and how effective vaccines are against it, and we still don't know that answer. And we still don't know how virulent it is. Is it more virulent or less virulent? So there's a number of variables there that we just don't know. And we're not going to know probably for about 2 weeks with some early information. There's a little bit of information coming out right now with some smaller studies, but we need some better information related to that. All that being said, case and contact management for a COVID-19 case, including Omicron, is the same, whether it's a Delta variant or the wild type. We're managing it in a manner that we prevent risk and mitigate risk for others getting the infection and to prevent issues related to developing an infection as well. So we're going to continue to do that unless the evidence changes.
From Global News, Brittany.
Hi, good morning, Dr. Atwell. When we spoke with you a few weeks ago, we were getting some modeling numbers that we're looking at the beginning of December and seeing that case trajectory possibly looking upwards of 200 cases. We are seeing upwards of 150 up to 200 on the weekend. What is what we're seeing now telling you based on the trajectory that we were looking at previous and where we're expected to go now?
So we're averaging about 150 cases per day right now on a trailing 7-day average. When you look at November, for the month of November, we're anywhere between 125 and 170 cases per day on a 7-day trailing average. That's definitely higher than October, where most of October are roughly averaging about 100 cases per day. So we did anticipate an increase in cases. You could in some ways say we're plateauing right now. What happens in the future is still a difficult question to answer. But I think we're going to anticipate an increase number of cases as well. And, seeing a 5 to 10% increase in cases on a week-to-week basis wouldn't surprise me. But it's really hard to know. It's really hard to predict that future because it all depends, again, on that vaccine uptake and how we're interacting and how we're following the orders and how we're adhering to case and contact management and partaking in those investigations as well. So I think from a future perspective, I think we're less cases now on a 7-day average than what was anticipated a few weeks ago. But I do see our case numbers rising over the next 2 to 4 weeks' time slightly.
Thank you. And my next question is for Ms. Warren. We've seen the toll this has taken on our healthcare workers, on our ICUs and our hospitals. What is the plan now? I know we spoke with you yesterday about, there are contingency plans. What are those contingency plans and how close are we to a point of breaking down, really to hitting that brink?
Yeah, like I mentioned, Brittany, unfortunately, we will be looking at needing to ramp down more of our surgical care in order to expand our ICU beds. So that planning is active and underway. And as I mentioned yesterday, we are still continuing to work on moving patients who do not need that high acuity care anymore and moving them to another setting with low acuity care. This will help to make room in order to accept more COVID cases.
From the Brandon Sun, Karen.
Good morning, everyone. We had worked on a chart there, just tracking the last 90 days, and no surprise, yes, cases are trending upward. But it was interesting to see where they were trending upward the fastest. No surprise again, it's around Southern Health. So just asking again, you said there are no changes to restrictions as of now. At what point do these cases have to rise before you start thinking about changing restrictions, either regionally or even provincially?
So there's evidence that we look at on an ongoing basis. We look at data and indicators on an ongoing basis from a public health perspective. Our table meets on a regular basis, and that table is comprised of physicians, nurses, epidemiologists, and others to discuss where our risk is and what can we do about the risk. So we're going to continue to meet. We've always met, and we're going to look at that and decide where that risk is. And this is a little bit more about case generation as well, right? So it's not just about cases, it's cases being generated and the impacts on the acute care system. So it's not just about case numbers as well. So again, we're going to meet on a regular basis, and we're having those discussions right now, taking into account the evidence that's available. And if and when future recommendations arise, I mean, we will provide that to government. And if orders change, again, we will provide that information to the public.
Okay, you faded out a little, but I got you there. Also, just kind of related, I've heard from a few people that were trying to get like vaccine exemption letters for things like being vulnerable or immunocompromised, and they're saying it's really difficult for them. I understand you want as many people as possible to get vaccinated, but is there any reason why these exemption letters and notices have become so difficult to come by?
So we created a process where individuals can see a list of specialists or a list of specialist types, and those individuals can submit exemptions that would allow somebody to get the same vaccine card that somebody who's fully vaccinated would be able to get. And that process has been working. There's a small number of people who have been issued the card because of medical exemptions. And we see that number really does reflect the very small number of people who have conditions that should exempt them from the vaccine. For most people, including those who are immunocompromised, the vaccine would not be something we would recommend against. In fact, for people who are immunocompromised, we recommend 3 doses because we want them to be protected at a similar level to everyone else. So we'll continue to use the process that was developed by our medical advisory committee, where individuals can be sent to specialists who will then assess them for a list of potential exemptions and then can submit that to the province to be able to issue those cards.
From CJOB, Rosanna.
Hi there. I'm wondering, what is the reasoning behind not considering sending COVID patients out of province at this point, if it could help us address the massive backlog we're facing?
So at this point, we still have capacity in our province. And so we are doing our best to keep Manitobans within the province versus sending them out of province.
And just switching gears here a little bit. So a large proportion of Manitobans are vaccinated, and a lot of them are looking at this holiday season differently than last year. Would you consider making COVID testing available for asymptomatic people if they, so they can gather with that extra layer of protection ahead of the holidays?
Just on the testing side, when we look at asymptomatic testing, rapid antigen tests aren't very useful in that situation. So there's a lot of evidence supporting that. We're trying to utilize tests in the most effective manner. I think from a gatherings perspective, I think adhering to the orders provides that safety net and managing risk as well. So again, if you are getting together, know the vaccination status of the people you're getting together with. There are limits on that in indoor spaces where if you are eligible for a vaccine, you should get the vaccine. You could partake in interactions with those individuals per the order, and there's really no limit on that. But if someone isn't vaccinated who's eligible, who's 12 and up, then you need to limit that to one household indoors, and you could have 10 outdoors as well. So, I think the orders help address that risk. Rapid testing or testing, it's hard to it's almost impossible to mitigate risk completely when we're looking at asymptomatic testing in scenarios like this. And it's not a good use of resources. So we have to manage those resources and expectations. And when we're doing the tests, they have to be done a certain way for them to be accurate. Otherwise, some people might find a false sense of reassurance with a negative test as well. So again, if you're sick, you stay at home, go get tested, wait for that test result. And outside of that, when you are getting together with others, in whichever environment is, make sure that you're following the orders and the recommendations from public health.
From CBC Radio Canada, Jeremy.
Bonjour. My first question, I did that you're trying to increase the number of beds for ICU, but at that rhythm, do you expect to send people out of the province? And if so, when? Is it a matter of days or a matter of weeks before that we will have no choices but to send patients to other provinces?
No, we are not at that point. We still have capacity in Manitoba, and we are planning to build more capacity. Like I said, we still have beds in the province. We are moving patients around to try and open up some room. And we may make some difficult decisions of reducing more non-COVID services to create ICU capacity in Manitoba. So I'm not saying that isn't an option we would consider or look at, but it is a last resort, and it is not where we are at today.
Perfect. And even if you can increase the capacity, some doctors tell us it does affect the services that you can provide to the patients. Some are asking for more restrictive measure. Do you intend some people to maybe put more restrictive measure in the province, doctor?
Again, this is challenging. We know that the acute care system is under strain. We have some of the strictest measures in the country in relation to how we utilize proof of vaccine and what's allowed and what isn't allowed under the orders as well. Again, we're going to have to look at that evidence. We're going to have to look at the impacts on society and health as well. And realistically, unless we start impacting those who are vaccinated, it's going to be really difficult to introduce other measures or greater measures. So again, we're working with the acute care system to understand that risk as well and be aware of that risk. And again, when we're going to review that evidence, and if decisions are made to make different recommendations or greater restrictions, we will provide that to government, and information will be provided to the public as well.
From CBC Manitoba, Bart.
Ms. Warren, can you please explain how it's possible to increase any more ICU capacity if, as you've stated, you're having trouble recruiting nurses and their previous targets have failed? Like, aside from further redeploying and canceling surgeries, what else can you just explain how expanding ICU capacity works at this point?
Sure. So when we look at the team that cares for the patient, we look at who else can do other parts of the care that doesn't require a nurse. So we are always looking at expanding those support positions. We've introduced a great number, hundreds of uncertified healthcare aides, both in the long-term care, but in the acute care system. As we're reducing surgery, we're looking at, who from those teams can all support in the ICU. And so certainly looking at how we can work together to stretch our teams to be able to care for more patients is active work. And obviously we need input from our staff to make sure that it is safe and that they are comfortable with how that's implemented. But yes, certainly in terms of next steps, when we reduce services, and surgery is one of the main ones, we look and try and match what skill set the staff have and what setting they can best provide it in. And so certainly I don't want to underemphasize the importance of that highly trained critical care nurse. But when we pull in team members alongside, like I said, this is really challenging for our teams. They're working in different ways than what they're used to. And so it's a big adjustment, but yes, certainly scheduled services like surgery is one of the main strategies in terms of trying to expand our bed base.
Okay, so big picture here. We hear this today at, between 10 and 11 a.m. Probably later today, we're going to hear the province announce a surgery backlog task force. How is it possible for the province to, on one hand, reduce services now to take care of critical care needs and then try to put services back elsewhere? I mean, it seems like a magic trick. Can you just explain how these two things could possibly happen at the same time?
Yeah, I'm going to defer any announcements that are coming around the surgical backlog. I don't know the details of that. And so at this point, I can't comment on that.
From the Canadian Press, Steve.
Thank you. I was just wondering to follow up on Bart's question. Aside from moving people around and canceling surgeries, what's being done to add personnel in the short term, given that it's hard to recruit people at this point in time in the pandemic from across the country, and B, it takes a long time to train people?
Yeah, our efforts have continued throughout the last year and a half to recruit, and I'm not saying it's easy, but we just recently graduated 40 nurses from the ICU course. Our challenge is that we have staff also leaving the unit, so we are always trying to look for staff who might be ready and willing to come into the ICU. I also want to say that, it's been incredibly humbling to see how much our existing staff are picking up extra shifts at overtime or at regular rates just to try and support the need, because they see how hard it has been for their colleagues. And so they continue to do that. And for that, we are extremely grateful. So those are short-term pieces. In the long term, certainly we are obviously trying to look at training more staff to come into the ICU. And on the short-term side, may need to pull staff who used to work in the ICU back into the unit by reducing services.
And Dr. Atwal, given that the holiday season is coming up, and you mentioned that the restrictions are on the unvaccinated, and there are certainly restrictions there in terms of the house parties and get-togethers and that sort of thing for people who are not fully immunized. Is the problem one of enforcement? If you want to keep people from getting together over the holidays in contravention of the rules, are you worried that the rules that currently exist are not being enforced, and that's why we're continuing to see case numbers go up?
Well, we've have really good restrictions in place. Historically, we've always seen a bump up related to different types of holidays as well. So we are cognizant that we are worried about that. On the enforcement side, enforcement can answer some specific questions, but they are very active, and you could argue that they're one of the most active in any jurisdiction in Canada in relation to trying to enforce the orders and providing tickets and education and everything that implies. Obviously, it's very hard to enforce private residences. There's only so many personnel to enforce. So this is a lot of messaging. This is a lot about talking about risk. And this is about, again, protecting each other, protecting our community, our neighbors, our friends, and our family. So it's impossible to enforce every single household. I think everyone does recognize that. But we do understand that there is that risk that's going to develop related to those gatherings. So we are preemptively messaging in relation to that. And there might be some more over the coming weeks in relation to the holidays in various aspects from public health that, could help mitigate that risk as well. So again, we're reviewing everything from a messaging standpoint, from an order standpoint, everything that public health is involved with to try to help mitigate that issue as well.
From CTV Winnipeg, Josh.
Good morning, Dr. Atwal. Just sort of following up on the holidays theme, you mentioned that there's no pending changes to the current public health orders. We've heard some other provinces might be introducing something more along the lines of guidance for the holidays. And I know you've sort of put an emphasis on, there's not much more we can do, to restrict people who aren't vaccinated, but is it possible there could be some guidance in place, not necessarily public health orders for gatherings over the holidays?
Yeah. So we are working on that guidance. I think we've done this in the past with different holidays as well. So guidance is being worked on that, which will incorporate the orders as well in relation to it and provide some further guidance. And we will be providing that out to the public in the near term.
And my second question is for Dr. Reimer. I'm just wondering if there are any health risks in terms of getting a second vaccine dose too close to the first. A woman we spoke to says she got it 2 weeks apart in error.
The main concern if someone were to get their second dose too soon is a decrease in effectiveness of that dose. So the studies used different minimums depending on which company we're talking about. But even despite the minimums that those companies found, we've really seen in Canadian data as well as around the world that longer intervals, 8 weeks in between dose 1 and dose 2, provide the best immune response. So if someone has gone below the minimum, that's very concerning that second dose just won't provide them the protection that they need, which means that they would need to get a third dose in order to have the same protection as other people after 2 doses. And while each dose is very low risk, the side effects are usually reasonable and very, very few people have severe outcomes related to the dose. Any unnecessary dose is a risk that we don't want people to face. So it is important that people review the date that they received their previous dose and make sure that the timeframes are going to provide them with that best possible protection. When they're booking, and then talk to the healthcare provider at whatever location they've gone as well to ensure that they do have an appropriate interval in between doses to help avoid any additional doses being required.
We have time for just a couple of extra questions this morning. Please proceed.
Dr. Reimer, it's Brittany from Global. I'm just wondering at what point there might be boosters offered for those under the age of 18.
So we do have a pediatric medical advisory committee that is looking at those types of questions. I don't have a timeline for when they might have recommendations, but they are looking seriously at that to make decisions going forward.
And just on vaccines again, if you could remind me, you had mentioned last week about the effectiveness of the third booster. Did you say that it could be like up to a year before you need another booster after this third dose?
So that's an estimate based on what we've seen with other vaccines. We don't know at this point how long the booster maintains a high level of antibodies, as well as what it does with other memory cells in the immune response. But certainly what we've seen and what we know about immune response more generally is that after a booster, when you've had that chance to remind the immune system and trigger an even higher response, we typically see a longer lasting immunity than we would after the initial series. And so we're certainly hopeful that we'll see a similar thing with this vaccine. There's no reason to expect that the immune response would be different. So my statements are based on what we see with other vaccines and anticipating that a booster would protect for around a year based on that, as well as some mathematical modeling that we've seen on this vaccine.
Dr. Atwal, Bartley Kives here at CBC. What do you think of the idea of sending rapid take-home COVID tests to people before the holidays so that, before their private gatherings, if somebody is asymptomatic, may have COVID, that just to combat the spread? What do you think the idea of the province sending some of that stockpile or new tests home with people to use prior to family gatherings for the holidays?
So the question was asked a little bit earlier. Again, we're reviewing things from a rapid antigen testing side to see the best utility of it. Asymptomatic testing does not work that well with rapid antigen testing as well. So again, we're reviewing resources that we have and the best use of those resources. And again, if something does change in relation to our recommendations or provisions, et cetera, we will provide that information to everyone.
Dr. Reimer, when we spoke to you, I believe it was last week or the week before, we were talking about the increase in cases among children, obviously before they were able to be vaccinated. Have we started to see those decrease at all, or are they still the biggest age group that we're seeing the rise in cases?
I'll maybe let Dr. Atwell comment on overall, but first I'll just say we wouldn't expect a response this quickly. After the first dose, we know that it takes at least 2 weeks for the immune response to fully protect somebody from what they're going to get from that dose. So it really is too soon for us to see any impact from this vaccine in this age group. But I haven't looked at the exact numbers in that age group, so I don't know if Dr. Atwell can comment on that.
Yeah, I don't have exact numbers, but I do know they are trending down. And that was actually even before the vaccine was available for that age group. So it's a slight trend down. And it's, again, as Dr. Reimer has mentioned, it's too early to see the impacts of that vaccination, even first dose and case generation in that age group.
Time for one more question.
Just on the topic of enforcement, we've heard a number of reports of actually fully vaccinated travelers being sent into quarantine by CBSA officers. I realize it's a federal measure, but when you compare that with anecdotal evidence of unvaccinated people and people not wearing masks, not following the public health orders throughout Manitoba, do you worry about the message that might send to people who've gone and done the right thing?
Again, I want to thank everyone who has been doing the right thing and will continue to thank them. I want to thank all the healthcare workers who have been working out there diligently and hard and working extra hours to take care of those who are coming in sick. I mean, this is challenging. Federal borders are much easier to patrol and secure for various reasons. And I think they're obvious in relation to access point and managing, clients who might be COVID positive. And just the sheer number of people coming through compared to a general population perspective. Again, we have orders in place. We are looking at enforcement, and enforcement is very important in those orders. Enforcement is out there. We have lots of individuals enforcing, but we do understand there are issues related to that as well. But this jurisdiction, Manitoba, on the enforcement side is much more active and has provided more tickets than a lot of other jurisdictions as well. And specifics to that could be, brought forth by the Department of Justice. I don't have those numbers there. So again, it is concerning in relation to risk with unvaccinated individuals or people, pushing the orders or maximizing what they could do under the orders, and even outright not obeying the orders. That provides that risk. And I think we're seeing that on the acute care side. We're seeing lots of unvaccinated people being admitted to hospital. So not only are they, not adhering to orders, but even the messaging and even vaccine uptake or believing in COVID. And those are real challenges that we face. It's not just our jurisdiction in Manitoba. Other jurisdictions have similar issues. So again, we're doing what we can with leaders, with local leaders, with representations of certain populations to help address this. And from a public health perspective, we're going to keep doing that to help, again, mitigate that risk to the province.
Thank you, everyone. This concludes our Zoom session.